Good evening, everyone. My name is Dina Bainey. I am the Youth Service Chair for the Rotary Club of San Fernando. And I'm very happy this afternoon to extend a very warm welcome on behalf of the Rotary Club of San Fernando to this meeting entitled Polycystic Ovary Syndrome and Mental Health. I will be your host for this afternoon session, this evening session. And we have a panel of speakers, which comprise of Dr. Stephanie Mohammed, Dr. Brian Coburn, Ms. Sasha Otti, Dr. Venkatizan Sundaram. And to get the session off, I would first like to introduce Dr. Stephanie Mohammed. Dr. Stephanie Mohammed is a researcher at the University of the West Indies. She has been conducting research on polycystic ovaries using animal models under the supervision of Dr. Venkatizan Sundaram and Dr. Nikolai Zvikov, I hope I have that right, over the last 6 years. Currently, she is conducting research under the supervision of Dr. Sundaram and Dr. Brian Coburn to establish the prevalence of polycystic ovary syndrome in Trinidad. She's also collaborating with renowned scientists in the field, Professor Ricardo Aziz and Ms. Sasha Otti. It is my pleasure to introduce Dr. Stephanie Mohammed. Dr. Mohammed.
Good afternoon, everyone. Thank you, Ms. Dina, for that warm welcome. So good afternoon again, everyone, and thank you all for joining with me this afternoon. We're going to discuss a little bit about empowering you, the youth, on polycystic ovary syndrome. And basically, it's just to bring a little bit about a little awareness on this particular condition. Okay. Now, in today's society, empowering youth is generally very crucial, and being able to raise awareness about polycystic ovary syndrome plays a significant role. So being able to understand what PCOS is, and that's the acronym for polycystic ovary syndrome. Sometimes you'll hear people say polycystic ovarian syndrome. But when it is you're able to understand, then you are able to recognize its symptoms. And with this, you can help to be able to assist in effective management. When you are able to do that as well, then you can provide support to young individuals such as yourself in overcoming this particular condition. But what exactly is polycystic ovary syndrome? Well, PCOS is a common endocrine dysfunction that affects 8 to 13% of reproductive age women. And the diagnosis for PCOS is based on conferences and reports that would have resulted from conferences by the Androgen Society for PCOS, the National Institute for Health, and the Rotterdam Criteria. And this now, because of these reports, the clinical manifestations of PCOS involves enlarged ovaries with small cysts. So in general, your ovaries, so this is how your ovary is, you will have 2 ovaries, and the progression from a primordial follicle to primary, secondary, mature follicle. When it reaches here, it is either supposed to go for from ovulation, either for fertilization or either for menstruation, right? When that does not happen and this oocyte here or this egg is not released or follicle, what happens is that it builds up inside the ovary into these small fluid-like sacs, which is what we call polycystic ovaries, okay? When this happens, it results in something referred to as a hormone imbalance. Hormone imbalance then causes irregular menstrual cycles, and then from this, you experience symptoms such as acne, weight gain, excessive hair growth, and excessive hair growth is something that we call or we refer to as hirsutism because of high androgen levels in the human body. And this then leads to complications, including fertility issues and increased risk of type 2 diabetes and heart disease, okay? Now, there are many causes and risk factors for polycystic ovary syndrome. So being able to identify the underlying causes and risk factors for PCOS, what happens is that healthcare professionals can assist individuals in managing their conditions and more effectively and being able to help them with personalized treatment plans. So if you look at this chart here, this chart shows something what it is we refer to as hirsutism. So women in general, they would find excessive hair growth on your lower, well, upper abdomen here, you would find on your lower abdomen, and then you'd also find on your arm. But you also find excessive hair growth on your face as well too. So sometime above here, which is the mush area, and then the beard area, okay? And then also on the sides of your face. Now, PCOS is believed to have multiple causes, including genetics, and some of the common risk factors that would have result from it would be things such as insulin resistance, obesity, and hormonal imbalances. So effective management of PCOS is very, very important because when it is we are able to efficiently manage PCOS, what happens is that it involves a multidimensional approach. So being able to incorporate something such as lifestyle changes is the key to effectively managing PCOS. Now, by making these lifestyle adjustments, individuals can actually improve the symptoms such as the irregular menstrual cycles that they experience. They can reduce insulin resistance, which is a very important biomarker observed in women, and also be able to manage things such as stress levels and overall promote their well-being. So lifestyle modifications such as regular exercise, having a balanced diet are very, very crucial to improving these symptoms. When it is you're able to manage your stress levels, get enough sleep, avoid smoking, and excessive alcohol consumption. Now, medications are also prescribed to help regulate menstrual cycles, to reduce your androgen levels, and those excessive androgen levels are what results in things such as, for example, an high androgen level is testosterone level, and that results in your excessive facial growth or hair growth or hirsutism in general. It's also very important to be able to address the mental health that is affiliated with these conditions, because what happens is that we are able to provide support and education to help empower you all to be able to take control of your health. Now, the general treatment for polycystic ovary syndrome till date is the universal treatment, which is diet and exercise. And after that, we have something referred to as medications. Now, when lifestyle changes are crucial for managing PCOS, what happens is that these medications, they also help and they play a very significant role in being able to manage the condition and mainly the symptoms that a person presents with. So medications such as birth control pills, metformin, anti-androgen drugs, clomiphene citrate, these can actually help to regulate your hormones, be able to help you manage symptoms and actually improve things such as fertility, because PCOS also results in something very, very important, which is infertility. Now, other in treatment options, which is our third major treatment option, is when it is we do more surgical procedures. So we have more invasive procedures such as assisted reproductive technology and surgery, depending on an individual need. So there's something referred to as laparoscopy, or we have ovarian drilling, and then we also have baroscopy, which is also very important as well too. Now, it's also important to be able to consult with your healthcare professional to be able to determine the most suitable treatment plan, because each individual presents with separate or personalized symptoms. So when you speak or when you consult with your healthcare professional, they are able to help you to develop a more personalized treatment plan. Now, you can live a better life, even though you have PCOS. It's not the end of the world. And it's very important that you consult with your healthcare provider. Also, it's very important that you educate yourself about the condition, and also you can join support groups to help lower the stigma. So when people speak about polycystic ovary, there's always a stigma that's attached to it. It's considered taboo because in some countries, you don't want to speak about it, because when people hear, okay, any problem with the reproductive system, then they say, okay, well, you know what, we can't marry this person or we can't do this, because most of the time marriage, people want to pass on their generation wealth. And when it is you're unable to be able to reproduce properly, then it tends to have a taboo and a stigma towards it. So as a young individual now, it's very important that we start to have more proactive measures. And that's the purpose of being here today, to educate yourself a little bit about what PCOS is and to help you to be able to consult a healthcare if it is you think you have any of these symptoms, and to also help you to be able to manage it. So thank you very much.
Thank you so much, Dr. Mohammed. If you have any questions, you can put it in the chat, or we can take it at the end of this session. So it is my pleasure now to introduce Dr. Brian Coburn. Dr. Coburn could not be here physically, so we have a video presentation from him. But before that, let me just read briefly a bit about his bio. Dr. Coburn, currently serving as the Dean of the Faculty of Science and Technology, has a career spanning over 20 years at the University of the West Indies, St. Augustine campus. Dr. Coburn holds the position of Second Vice President for the Diabetes Association of Trinidad and Tobago. Dr. Coburn's research endeavors center around the development of non-invasive techniques for diabetes mellitus assessment, with a goal of enhancing awareness and fostering effective screening initiatives in the community. And insulin resistance and type 2 diabetes have associations with PCOS. Dr. Coburn plays an important role as one of the investigators and one of the current supervisors in the project focused on assessing the prevalence of PCOS in Trinidad. So let us look now at Dr. Coburn's presentation.
Empowering the future, unraveling the significance of type 2 diabetes, insulin resistance, and polycystic ovary syndrome in youth education. In the quest to empower the future generation, it is crucial to unravel the significance of type 2 diabetes, insulin resistance, and polycystic ovary syndrome in youth. By understanding the interplay of these conditions, educators can better equip themselves to address the health challenges faced by today's youth and empower them with the knowledge to make healthier lifestyle choices. What is diabetes mellitus? It is a group of metabolic diseases characterized by hyperglycemia or high blood sugar, resulting from defects in insulin secretion, insulin action, or both. It's often described as a multi-organ disease, as it can affect several different organs in the body. Diabetes mellitus has a prevalence estimated at 14.5% of the adult population of Trinidad and Tobago. That's divided amongst different kinds of diabetes, including the two main types: type 1 diabetes, which is an immune-mediated disease caused by beta cell destruction, leading to absolute insulin deficiency; and type 2 diabetes, which is more common, representing just about 90% of all cases of diabetes. It is characterized mainly by insulin resistance with insulin deficiency, or mainly an insulin secretory defect with insulin resistance. Pay attention to insulin resistance. There are other forms of diabetes: maturity onset diabetes of the young, the acronym is MODY, and other monogenic forms of diabetes, unlike type 2 diabetes, which is caused by a number of changes to a number of genes superimposed on a permissive lifestyle. MODY is caused by changes to single genes. There's also maternally inherited diabetes and deafness syndromes. These are mainly mutations in the mitochondrial genome. genetic defects in insulin action, diseases of the exocrine pancreas, drug or chemically induced diabetes, and even infections that can bring about diabetes. Type 2 diabetes is primarily caused by a combination of genetic and lifestyle factors. The risk factors include obesity, physical inactivity, poor diet, family history, and racial background. Understanding these causes and risk factors is crucial for educators to develop comprehensive prevention strategies and ensure that youth receive the necessary education and support to empower them in preventing type 2 diabetes. What is the relationship, though, between polycystic ovary syndrome and type 2 diabetes? Well, it's a significant relationship. Some studies suggest that high testosterone associated with PCOS promotes insulin resistance. The relationship is complicated, though, in that high insulin levels in turn promote high testosterone levels through multiple mechanisms. To empower the future generation, educational interventions for youth with type 2 diabetes and PCOS are crucial. These should focus on promoting awareness about the relationship between the two conditions, educating on the importance of early detection, which requires frequent screening and prevention, and providing tools and strategies for effective management. By equipping young individuals with knowledge and support, we can foster healthier lifestyles and improve long-term wellness outcomes. Diet and exercise are key. Taking proactive measures to educate and empower youth about type 2 diabetes, insulin resistance, polycystic ovary syndrome is essential. Thank you. I now turn you back to your moderator.
Thank you so much. So it is my pleasure this evening to introduce Ms. Sasha Otti. Ms. Sasha is founder and executive director of PCOS Challenge, the National Polycystic Ovary Syndrome Association, the leading 501c3 support and patient advocacy organization globally that is advancing the cause for women and girls with PCOS. Sasha started the organization after she was diagnosed with PCOS and experienced great dissatisfaction with the availability of support resources for women with the condition. Under Sasha's leadership, PCOS Challenge has quickly grown to over 55,000 members and has helped many women overcome their struggles with infertility, weight gain, anxiety, depression, and reduce their risk for numerous life-threatening related diseases. As executive director of PCOS Challenge, Sasha built a coalition of over 70 major national and international health organizations and led the first successful legislative advocacy effort in the US Congress to recognize the seriousness of PCOS, the need for further research, improved treatment and care options, and for a cure for PCOS, and to designate September as PCOS Awareness Month. I'm very happy to have Ms. Sasha Otti with us this evening, and to let you also know that even though she lives in the States, she is from the Caribbean. I think it's Jamaica. So welcome, Ms. Otti. I think you're muted.
Thank you. Good afternoon.
Good afternoon.
Thank you. Thank you so much to the organizers for inviting me to be here today. And yes, I am Jamaican. I live in the US, but definitely representing the Caribbean. and including the Caribbean voice in PCOS advocacy. So I would like for this portion of the evening to be more interactive. So I'll be asking questions, asking you to be responding in the comments. But I'll start with, if you think you have PCOS, if you have been diagnosed with PCOS, let us know in the comments section, because I think it's really important for us to share with each other the things that we're going through. And that's a big part of advocacy and a big part of educating each other. So if you have PCOS or anything you've learned so far from our previous presentations lead you to think that, okay, maybe I might have it, just share in the comments if you feel comfortable. So my talk is Living Happier with PCOS. This is not medical advice. Please see your doctor or healthcare providers for medical advice specific to your needs. So today we'll cover just a brief overview of PCOS Challenge, who we are. I'll add a little bit about what PCOS is. There are a few PCOS patient stories, but the most important part is to become an empowered person with PCOS. And this is the perfect time when you're a young person to be more educated about your body, about PCOS, and how you can empower yourself. So this is my story. I was a microbiologist. I got diagnosed in 2008 by an OBGYN. I missed a few periods and I went to her and I was concerned about that. And she said, okay, you have PCOS. She did the blood work. She gave me the diagnosis, but then she said, don't worry about not having a period, because plenty of other women would love not having their periods. Completely dismissing my concerns, but then also that was inaccurate. Not having your period is your period is a vital sign. So not having a period can be a signal for problems to come. So this diagnosis was a defining moment for me, because I had multiple interactions with healthcare providers who continued to dismiss me, dismiss my concerns, told me to come back when I want to get pregnant or come back when I have lost weight. So, and this is something that people with PCOS around the globe have experienced with their healthcare providers as well. So I was brought to this quote where it says, I always wondered why somebody doesn't do something about that. And then I realized that I was somebody. And this PCOS diagnosis was a defining moment for me, and I decided I needed to do something. So I started the organization, because one person can make a difference. And that's true of all of us here today. PCOS Challenge is the National Polycystic Ovary Syndrome Association, as you heard earlier, and we serve nearly 60,000 members. Our mission is to raise public awareness about PCOS and help people with this disorder overcome their symptoms, reduce their risk for related disorders, including stroke, diabetes, cardiovascular disease, and cancer. Our vision is that PCOS is treated as a public health priority. But long-term, we would like to eventually understand the disorder enough to realize a cure. We've done awareness efforts. Here we have had multiple 5K events, running and walking events, promoting physical activity, and also support and awareness in the respective cities. We've done educational events since 2013 and have had large forums educating thousands of patients per year, and also healthcare providers. And advocacy efforts. This was one of our biggest strategic efforts, was to start advocating on with our legislators, right? Because once we understood the nature of the relationship between or legislators and them funding research, it was imperative that there was an advocacy force that was educating legislators about the need for prioritizing PCOS. All right, so what is PCOS? You've heard earlier, but I'll give you a little bit of the history. PCOS was first described in 1935. It was first given a name. It was called Stein-Leventhal syndrome, named after the physicians who discovered it or described it. It's the most common endocrine disorder in women, and it's one of the most common human disorders. And as you heard earlier, a leading cause of infertility. One important thing, though, to realize or to note is that even though it is a leading cause of infertility in women, not all women with PCOS experience infertility. Some people have multiple children, 6 children or more, and but they were always taught or told that they could not have children. This is false. You may be delayed in getting pregnant when it's your time to do that, but plenty of women do get pregnant even though they're told that they could not. The diagnosis. In order to be diagnosed with PCOS, you need to have 2 of the following: irregular menstrual cycles. In younger women or teenagers, that's if you have irregular cycles that come less than 21 days apart or longer than 45 days apart. In adults, it's less than 25 and longer than 35. If you have blood work or signs of high androgens, such as Dr. Mohammed mentioned earlier, a lot of facial hair, or even, it doesn't even have to be a lot, it could be enough to bother you, to cause issues on your face, on your the mustache area, chin, etc. And some people have severe acne or even hair loss. So it can really impact multiple areas of people's appearance. And on ultrasound in adult women, you may find polycystic ovaries, as Dr. Mohammed showed earlier. So, but one important thing is your doctor needs to exclude other disorders, such as thyroid issues or even tumors. So these are common signs and symptoms: hair loss, severe acne, sleep apnea or difficulty sleeping. Anxiety and depression is extremely common in PCOS compared to women who don't have PCOS. Insulin resistance is one of the underlying issues of PCOS that can drive other things, such as the high androgens, as Dr. Coburn mentioned in his presentation, and irregular absent periods. That's one of the first signs of PCOS in many people. So if you have periods that come less than 21 days or less than 25 if you're an adult, or they come if you have longer than 45 days if you're a teenager, or longer than 35 days before you get your other period, that's a sign that you need to bring it up to your doctor. So PCOS is an opportunity to prevent other disorders. So that's why I'm really excited to speak to people who are younger, because this is the age to really understand your body and understand things that work for you to address your health. So what should happen? You should be screened. Your doctor should be screened. If you are a PCOS patient, they should be screening your metabolic health, your heart health, emotional wellness, assessing for disordered eating, and also endometrial cancer and other cancers. So, and this is how they would screen. Some of them may use surveys, but it's very important that your doctors understand the impact of PCOS and the connections to different disorders. So PCOS can have a very severe impact on mental health. I'll read some stories, a few from some patients. This is Vicky. Vicky spent her life missing school, parties, and other important things, thanks to difficult monthly cycles and pain when she had her cycles. She always had weight issues, and all the women in her family have PCOS. This is very common. A lot of PCOS is a genetic disorder. She's seen all these doctors, and her entire life she has been full of pain, discouragement, and embarrassment. And she has other serious health issues and is on disability. And this is not uncommon. A lot of people with PCOS will also have other chronic illnesses. And that's why it's so important to address this at a younger age. And this is Keisha, who has been misdiagnosed for over a decade. Also very common. 50 to 70% of PCOS cases are undiagnosed or misdiagnosed. She suffers from weight gain, eating disorders, anxiety, and depression, and has had so many doctors who simply told her she was too fat. And also many doctors who have never heard of PCOS before. And please leave in the comments if you can identify with anything that's being said here today. If you have a doctor who's never heard of PCOS, if you're a PCOS patient, share in the comment below. That is also quite common. It can be very lonely and confusing, says Keisha. And then this doctor, as a pediatric endocrinologist, she sees a lot of adolescents struggling with lack of periods, excess male pattern hair growth, and weight gain. And their mother also shared their own stories, now realizing that she herself had PCOS at a younger and developed type 2 diabetes at a younger age. Earlier recognition and intervention could have improved the mother's health and prevented chronic metabolic disease. So now that opportunity is now there for her daughter, thankfully. So what's the treatment? Nutrition and supplementation, as you heard before, exercise, medications. And you might ask, what type of diet, what type of supplements, and what type of exercise? The thing about it, it's different for everyone, but one of the key things with nutrition is to add more things, healthy things like fiber and vegetables, and so pay attention to the processed food. Try to eliminate that as much as possible, or if you do, always have include protein and fiber and vegetables with your meals. Exercise for the same. For some people, they like muscle building exercises, which is really helpful for improving insulin resistance. And for some people, they require lower intensity exercises such as yoga. Hair and skin. You should always see your doctor if you think you have facial or body hair growth that's excessive. If it could be a hormone disorder such as PCOS, and there are medications to help to reduce that, but it doesn't go away. It can help to reduce it. What can help are expensive treatments such as electrolysis and hair removal. But those things by themselves, without the lifestyle and without the medications, don't always work, or it could come back. So you have to, this is a lifestyle change that's required. But the biggest part I think of PCOS treatment is addressing mental and emotional well-being. Because if we're not feeling well, if we're dealing with depression and anxiety that's not being treated and not being controlled, and you have no support, this can in turn promote not so healthy lifestyle, and it can also in turn promote building up stress, which can cause other anxiety and depression. So treat your mental well-being with stress reduction. Try to be as mindful about reducing stress in your life. Mind-body techniques such as yoga, walking, or running are helpful for some people, or seek help with a professional, a therapist, or someone who is a professional in behavioral health. And good sleep habits. This is really important, and it's very hard, I know, if you're in college or university, and it's very hard to get adequate sleep, but 7 to 9 hours of quality sleep is really helpful for helping to manage PCOS. Mental health. As I mentioned, anxiety, depression, mood swings, irritability, these are also quite common in insulin resistance and inflammatory disorders, which PCOS is both. But the body image issues that may come with disorders such as the facial hair, or weight gain, unexplained weight gain, or even the acne or hair loss, these are quite significant. And I know for myself, when there was times when I would lose hair and I'd see a clump of hair in the shower, and I remember just crying because and I've heard so many people say the same thing. Just seeing that clump of hair in the shower just made you feel like there was something wrong. And this is something that is so common in PCOS. It's not your fault, regardless of what a doctor may tell you, or another person may tell you. It's not your fault. As we heard before, it's a combination of genetics and also lifestyle, but PCOS is a genetic disorder. So you were predisposed to getting it, and some of the things in the environment or lifestyle could have triggered you getting PCOS. And eating disorders is a really big one, because we're told to lose weight, eat less, exercise more. And some people take this to heart, and they may over exercise, they may under eat, they may binge eat, and they will develop disordered eating behaviors. So what I mentioned earlier about this being a lifestyle change, that really is, as you heard Dr. Muhammad mention earlier, that really is the case. There's a lot of pressure to lose weight, and there's a lot of pressure to be healthier with PCOS. But putting additional pressure is unfair, because as I mentioned before, it's not your fault. So take your time to learn what works for you, okay? So I have a question. Do all people that have PCOS have anxiety? No, but more people with PCOS are more prone to getting anxiety than people without PCOS. It's very prevalent in PCOS. So how do you address your mental wellness? Stress reduction techniques. If there's anything that you do that helps to reduce stress, please put it in the chat. I don't see anybody really commenting about, but this is not specific to PCOS. This is about stress reduction. What do you do to reduce stress? As I mentioned before, there are mind-body techniques such as yoga, which is very helpful and calming. It's a type of exercise, but it's also mind-body. Someone listens to music. That's really helpful. For me, I do that. I listen to music. I also just downloaded an app called Calm, which it helps to, helps to keep you calm, has various calming stories and things like that. So I know use that to help me to go to sleep. Exercise. Some people use exercise to lower their stress. So I see music or basketball. Music is very calming to a lot of people. Behavioral health therapy. Therapists are very helpful for talk. There are talk therapists. There are people who use cognitive behavioral therapy. There are multiple techniques to help with improving mental wellness. And don't forget good sleep habits. So in the comments, someone said to get in touch with nature, fresh air. Yes, I cannot recommend that enough. Watch the sunset. If you're in Trinidad, you have a beautiful sunset there. Just definitely take advantage of the things around you to help to lower stress. Reading. Exactly. So someone asked, can laser treatment be used to permanently remove the excess facial hair? Laser treatment is called laser hair reduction for a reason. It helps to reduce the hair. It does not completely eliminate the hair. A lot of people say they've done laser. It's very expensive, but if you have access to it and you have the skin and hair type for it, meaning laser is better for lighter skin with dark hair. That's the perfect candidate for laser. But there are types of laser specifically for dark skin that may prevent burning. But no, as I mentioned before, if you don't address the underlying issue, which is the high androgen, the high testosterone, either with medication and lifestyle treatment, it may come back. It may come back. So I don't recommend using laser if you want it to be using laser without addressing the underlying issue of PCOS. What's recommended if bleeding occurs regularly? Regular bleeding, definitely see your gynecologist, because I'm sure they will give you oral contraceptives or birth control to help with the bleeding. But there are multiple techniques, and depending on what the reasoning is for your bleeding, you may have to try different things, but I would suggest that you go to your gynecologist. Okay. And lastly, advocacy. Advocating for yourself. There are certain things that may happen: negative self-talk, bullying, body shaming, unnecessary comments, especially in high school or younger. But people can be very unnecessarily mean to other people. And then gaslighting, sometimes even parents may gaslight you, or doctors may gaslight you. They'll say, oh, you haven't done what you said you did. Like you weren't changing your eating habits, or you didn't try as hard. So what can you do to address this? You can do affirmations every day. Tell yourself you're great. Tell yourself you're beautiful. Tell yourself that you will accomplish everything. Just give yourself the positive self-talk that you need. And also be compassionate to yourself. Speak up for yourself. You can do it in a respectful way, depending on who it is and what they said. You can do it in a respectful way. Let them know you're going through something if you see that as fit. Educate them. Educate people about PCOS, about what you're going through, about how it impacts you. And you set boundaries. Tell them you don't want to hear them talking about your body that way. Don't give them permission to talk about your body that way. And ask for different options. So if for example, if your doctor told you you need to do something, you need to lose weight, ask them for options on how to do it. And some self-empowerment. Self-empowerment means you educate yourself, you know what you're talking about. And even if you don't, you're going to educate yourself and figure it out. So hopefully, we're moving from a disempowered state, which is not being sure of what to do, being uncertain where to start, be unwilling to talk about your PCOS, and feel that your voice has little power. Your voice does have power. Even if you do it, you speak one-on-one with someone, with your doctor, with your parents, with a friend, your voice has power. And so we're moving to the empowered state where you can identify areas of PCOS care that you're dissatisfied with and address them accordingly. Seek out help and articulate how it impacts you. And like I said earlier, set boundaries, and then use your story and your lived experience in your own way to help to drive change through whatever PCOS awareness events are happening, like this one. Teach someone else about what you learned today. So that's the state of becoming empowered. So thank you very much. I hope at the end of this day, you will feel more able and more knowledgeable about PCOS, and know that it takes you being an empowered patient to turn your mental health and your mental well-being with PCOS into something that works well for you. Thank you very much, and thanks to the organizers.
Thank you, Ms. Otti, for very interesting. I'm certainly being educated tonight. Next on our agenda, our last speaker is Dr. Venkatasan Sundaram, and he is head of the Department of Basic Veterinary Sciences at the School of Veterinary Medicine, Faculty of Medical Sciences. A distinguished translational researcher, his primary focus is on reproductive biology in animal models, aligning with the One Health concept. Currently, he actively mentors Dr. Stephanie Mohammed in assessing the prevalence of PCOS in Trinidad. He has been successful in securing multiple research grants during his tenure at UE. With 72 research publications, he demonstrates expertise in reproductive biology and comparative vertebrate morphology. Dr. Sundaram's commitment to research and education continues to have a profound impact on the scientific community and beyond, solidifying his position as a leading figure in his field. Welcome, Dr. Venkatasan.
Thank you. Thank you, Ms. Yes. Sorry about that. Yeah, thanks for this wonderful opportunity. I think my earlier speakers has given a detailed information about the PCOS. Now, I'll take it further to create awareness about what is going on the PCOS research and what is the role of UV in this mission. So as it was discussed earlier, the condition polycystic ovary syndrome is a very important condition as it affects almost 10 to 12% of the reproductive age women. So that means it is an important problem. And we have seen in the Ms. Sasa Oti was talking about all the issues related with that one. So we need a research on this condition. Why we should need a research means, you know that research is the only thing which will bring the practical solutions for the problems. So that's why PCOS become an important area of research in the current scenario. 6 years, I think 7 years ago, Dr. Mohammed came to me and she was telling that she is interested in PCOS research and she want to do a human research. And when we are going through the review of literature and all, we found that first thing is what we have to do is we have to do an animal research. Then we will go for human trial, right? So this PCOS research, why we are doing it means we will try to understand the causes and risk factors associated with the PCOS and to develop diagnostic tools and treatment options and management of symptoms associated with the health conditions. That is our motto. So for that, we prefer first the animals. Why we prefer the animal means research in animals allow to dissect the biological mechanisms underlying the PCOS so that we can get the valuable insights of the condition's development and progression in humans. How we are doing that one means we have to create an animal model in the controlled environment to study the PCOS development. Then we will induce the PCOS condition in animals and we will test the hypothesis and potential treatments before moving to the trial. And even we will use these animals to identify the biomarkers, then treatment development. And as Ms. Oti was telling, it is a genetic problem also. So we can study easily the genetic and the epigenetic reasons underlying that one. Then we can study the hormonal dysregulation, then the environmental factors. All these things can be easily done in animals. Then we have ethical considerations when we can able to do the research in human beings, but we have a lot of ethical considerations and restrictions are there. So it's relatively easy to do the animal research, and preferably we do the research in the rats. Then a long-term study can be done in the animals. So once we study the hypothesis, what we have taken, then it will be translated into the clinical practice so that way we reduce the time in spending the research in human beings. So thereby, when you integrate the human and the animal studies, then we will get a holistic understanding of the PCOS. That is the reason we are doing animal research. Then after that, we are having human research. And most important thing to carry out your research is funding and support. So we collected several funding from the University of the West Indies. Then even in our last research, the Rotary Club sponsored some of the portions of our research, and they also brought some sponsors, and that funding was very important to carry out the PCOS research. So what we are doing at the University of the West Indies in the PCOS. So first we did animal model research. As you all know that people, those who are having cancer, they will undergo chemotherapy along with radiation. That radiation, we found that can able to reduce the cyst. So we took that concept and we tried one particular frequency of electromagnetic radiation to see the effect on the development of the polycystic ovary syndrome. So our hypothesis is that this electromagnetic radiation can be a non-invasive treatment for the polycystic ovary. We did in one model by inducing the polycystic ovary artificially in the rats. then we got a very positive result that that particular wavelength of radiation can able to reduce the number of cysts. Then we got excited about our results. Then we want to confirm that result by testing in another model. And we have completed that research also. The results were very positive, and we are planning to publish the research in the journals, and we are planning to get the patents also for the research. Once we have completed this animal model research, then we would like to carry that research to the human model. So for that, before entering to the human research, we would like to study the epidemiology or the prevalence of the polycystic ovary condition in Trinidad. So for that, we got a research project, and currently we are doing the polycystic ovary prevalence in the Trinidad. So far, we have collected blood and we examined more than 250 women across the country, and the research is going on. When we were doing that, we realized that a lot of people, they lack awareness about the PCOS. Then we started doing awareness seminars. 2 months, I think 3 months back, we did one seminar, which actually 25 countries, people, more than 250 people, they participated, and it was a huge success. Then, with the help of Rotary Club, we can be able to create awareness in different parts of this country. So this is our second seminar. So all these things are targeting the people. They should be more aware of that condition, so that this is going to help them in several ways, so that they will be more informed. So for this, we had a lot of collaboration across the diverse discipline. So as I told that, Rotary Club is supporting us in several ways. Then Ms. Sasa Oti is giving support. Then Professor Ricardo Assis, the renowned PCOS researcher and gynecologist, he is giving his valuable inputs. Then we have Dr. Brian Coburn, the Dean, Faculty of Science and Technology. He is a diabetes expert. He is giving. So with all these inputs, Dr. Stephanie Mohammed is carrying out the research, and we are all behind her, and we are guiding her. So these are all the things we have done. So this is our first research, which we were done with the rats model. Then after that, here we are just collecting the blood from one of the participants, and we were very happy that a lot of people in the country, they volunteered themselves, and they came and they participated in the study. And we are doing research by scanning electron microscope. We will just testing the polycystic ovary, that is the ovarian cyst. So these are all our research publications so far. And another 3 publications are under review. These are all good impact factor journals. These are all the things what we have done to create awareness in the country about the polycystic ovary. As I told that, so we are having this seminar. Then we try to give more advertisement for this condition, so that a lot of people will come to know what is going on. What is the potential benefit of the PCOS research means? This research can provide an improved diagnosis. Then a personalized treatment options can be developed. Then fertility enhancement through innovative fertility preservation, then preventive measures, then long-term health benefit, then mental health support, then global impact because once you find something, this is going to be used all over the world. So that standardized care will be, people will be getting, and it will be having a global impact. And health equity, by doing the research, we are telling that what is happening in this part of the world and what is happening in other part of the world, then there will be a comparison, and the new trend and new techniques will be used across the world. So thereby we can improve the quality of life, and overall women's health will be improved. These are all the potential benefits of our research. Not only our research, in general, the polycystic ovary research. The future direction of the PCOS research across the globe is that first they target that precision medicine. That means tailoring treatment based on the individual patient profiles that include genetics, hormonal status, and metabolic factors. Then they focus on the epigenetic modification. What are all the modifications which are happening in particular candidate? Then we can understand the PCOS development and progression. This is one of our goals, what we are doing here. So we are trying to understand in different races in the country how the PCOS is getting expressed phenotypically and genotypically. So that is what we are doing. Then there is a microbiome studies which investigates the gut microbiome impact on the PCOS and the potential interventions. Then advanced imaging techniques were used to understand the ovarian morphology and the function. Then nutrition and lifestyle, developing the all over the world, a lot of research is going on to develop personalized dietary and lifestyle interventions. Then mental health, it was discussed in the last presentation. So integrating the mental health considerations into the PCOS research and care. Then studying long-term health sequences of PCOS beyond the reproductive years. Even after the reproductive years, what is the health consequences? That a lot of research is going on. Then advancing the fertility preservation options for the woman with the PCOS is going on. Then, as I already told, that the health disparities can be addressed. Then the telemedicine concept is now expanding so that we can remotely monitor the PCOS patients and they can manage the condition. And a lot of research is going on with the patient-centered research. All right. Then global collaboration. See, in our case, we are collaborating with the Prof. Asis, who is in US, and Dr. Sasawati is in US, and we are in Trinidad, and we are doing research with people in India. So like that, global collaboration is happening. And prevention strategies also, a lot of areas they are doing. So interdisciplinary research is going on, and they are studying the environmental factors, what's going to affect the PCOS. So in general, you all know that in this world, cancer is the one area where majority of the research is going on. Majority of the research and research funding is going on to work on the cancer research. But the reproductive physiology is a very important area, because we have seen that it can affect mentally, and it can affect physically, then it can affect in all the ways of our life. So extensive research is currently going on in the PCOS, and for our part, we are focusing to find a non-invasive treatment by using a electromagnetic radiation. That is what our focus, and we are succeeding with a reasonable success. And maybe when we complete this research project, then we will come to know that what is the status of PCOS in Trinidad and how it is expressed, in different races and what are all the common symptoms we see it. And based on that, we can able to devise a better treatment option. So that is our goal of the research. So this is what I would like to tell about what is PCOS research, what's going on around the world, and what is going on in UV with the mission of doing this one. And this research is supported by Rotary Club. Thanks to the Rotary Club also for this one. Thank you for the opportunity. That's all my talk. If you have any questions, you can put it in the chat.
Thank you so much, Dr. Venkatasan. I would like now to invite you, if you have any questions, you can put it in the chat or you can put up your hand and we will try to accommodate you. Preferably put it in the chat because it will be difficult to identify sometimes when you put your hand up. While you're doing that, I really want to congratulate and to thank the Interact Clubs of Presentation College San Fernando, St. Joseph's Convent San Fernando, Astra Girls College, Naparima Girls High School, and St. Benedict's College for your outstanding participation this afternoon. At one time, we had 100 participants on the meeting. So thank you so much for your attendance. Also the Rotaract Club of San Fernando, I see a couple names. So please, if you put in your questions, our facilitators will be able to answer you. I'll give you a minute or so to do that.
Excuse Ms. Dina, they could also unmute their mics and ask their questions.
Yeah, okay. So you can unmute and ask your question. I know you have been bombarded with a lot of information. And for some of you, this might be an area that you may want to get into, you know, in your furthering your studies. So so we have bright people on this. You're the cream of the crop. I'm sure you have questions.
I understand that persons might be shy because the polycystic ovary syndrome and general reproductive health is it's taboo, the topic.
Yes.
Very difficult to speak about, but you may, even if it's not you, you may have a friend, a family member, a colleague, you might have someone that's also experiencing symptoms or, you know, anything that you would have heard here today. I'm seeing these hands up. Casey, please go ahead and ask your question.
I was wondering what the club or the organization itself does if it goes around and it informs people about the awareness of this disease or something.
You mean the Rotary Club?
Yes.
Well, I know that the three Rotary clubs in Trinidad, they are assisting the research. There were articles on the newspaper. I think Dr. Venkat had shown it. And the people have volunteered, as he said in his discourse, that people have volunteered to be part of that research. And by bringing it to San Fernando, bringing it to our school, our sponsored schools, this is one way of getting it out. That's why I was, telling the group, the 5 schools, the importance. It may not have affected you directly, but it may have affected your relative, your mom, your sisters, someone you might know. So it's good about attending it and being educated about it. And now you can go out there and talk about it.
Okay, thank you.
You're welcome. Any other questions? We don't want to keep our facilitators too long. So if you don't have any more questions, and if later on you do have, you can always send it to me. I have no questions, but just wanted to add how in the Caribbean persons don't really recognize PCOS. Dr. Mohammed, we want to answer that.
Okay, so that is, I wouldn't say in the Caribbean. So right now in Trinidad, PCOS is under studied, and that's the purpose of having collaborative research and joining with other persons as well to be able to advocate and also bring about awareness. But Miss Sasha Uti is a more experienced because she's also from Jamaica and then she's based in the US. So she will also add some more information regarding this.
Okay.
Yeah,
Sasha, please.
the condition is under-recognized globally. And yes, especially in places like the Caribbean and other places like African countries, where the research is very limited or non-existent. And also awareness activities or awareness organizations or patient-run organizations are non-existent. But there are places in the Caribbean that have PCOS awareness activities going on. We have partnered with many of them to help to raise awareness. And of course, we spoke with Rotary about doing more PCOS awareness in the Caribbean. So we definitely look forward to the impact, the growing impact that we all will have together.
Thank you so much. And there are Rotary clubs across District 7030. So I am certain that, it will spread across the Caribbean.
So I'm seeing a chat in the question, a question in the chat. Are there any special doctors to go by to get checked? So with regards to PCOS, you can go and check your healthcare provider, which would be your gynecologist. You have your endocrinologist. You could also check your regular physician as well too. Because PCOS is affiliated with so many different conditions, we would normally recommend that you check your gynecologist first and your physician, and then they would also run some blood tests, and then they would tell you, okay, well, where else that you should probably be attending. Sasha?
Yeah, I can add some more on this. So when you have the irregular periods and body hair at unusual places or the acne you find, then you can suspect the conditions and you can go to any physician, then they will just make a preliminary diagnosis about that. Then further, if it is needed, then they will go for further testing. If you have access with the gynecologist, then that is an excellent option.
Yes, and it's different everywhere, right? So in the US, some people may see their primary care doctors and they may get referred to primary care doctors or gynecologists. So a gynecologist is also like a primary care physician for women here. And they may get sent to an endocrinologist to help with some hormone things. They even here, some doctors can't prescribe certain medications unless they're in they specialize in endocrinology, etc. And so one of the first doctors I saw was a dermatologist, and that doctor missed the diagnosis because we didn't talk about my periods, right? So I went for hair loss, and somebody might go to a dermatologist for acne. But hopefully, as the years have gone on, there's been more awareness, and multiple specialties may ask about your periods. And if they ask about your periods, that's a perfect opportunity to get a diagnosis if you have irregular cycles or other signs of PCOS.
Dr. Coburn, would you like to add anything to that?
Hi. No, Dr. Mohammed. I think Sasha and Dr. Sundaram pretty much covered all the angles.
But Dr. Coburn, if someone has a type 2 diabetes and they suspect themselves of having PCOS, what would you do in a case like that, sir?
In all cases, if you suspect that you are in fact having either diabetes or PCOS, you definitely should get it confirmed by a medical practitioner. Yeah, constant screening is important, early detection. Both diabetes and PCOS, it is important to have as early detection as possible because that's when treatment can be most effective. Thank you.
Welcome, Dr. Corbin. I'm glad you're able to make it.
Thank you.
Okay, so I'm seeing that some folks are dropping out, and you know, in everything we like to give thanks. So I really appeal to those present. If you do have questions, you can always send it to me, and then I'll get it out to the facilitators who will be able to answer your questions at a later date. So before we end, I really must thank the facilitators, and bear with me because, you know, a lot of time has gone into preparing for this. And I would really like to do, you know, thank you properly. So to Dr. Stephanie Mohammed, thank you so much for your discourse, empowering youth, for explaining to the audience what PCOS is, how they can effectively manage it by their lifestyle changes, and, you know, the importance of reducing their androgen levels. For alerting them about the treatment, the medications, the importance of seeing a healthcare professional, and for educating themselves. So thank you so much for the part that you played tonight. Dr. Brian Coburn, thank you so much for, you know, making the time to send your video. Your link with PCOS and diabetes mellitus. For me, that was education itself. I had no idea that they are linked. Thank you for, you know, the alerting us about PCOS and the different types of forms of diabetes, and the importance on early detection and for frequent checking. To Sasha Otley, thank you so much again to becoming, impressing upon our audience the need to become empowered about PCOS, and for sharing your story, for making PCOS challenge a public health priority, how very important that is, for sharing the mission and vision of PCOS challenge, and for the many ways that you have brought awareness worldwide through walks, education, advocacy efforts, and for emphasizing that the latter is the greatest strategic effort that you participated in. For making us aware that it is really a silent epidemic, and the need for the young people to take care of their health, their emotional wellness. And I'm not sure if you're aware that one of the themes this year in the district is mental health. And when I heard about the PCOS, I said this must have mental health challenges. So I'm very happy that you addressed this aspect of it and the importance of emotional wellness. Nutrition, the supplementation, the exercise, the need for lifestyle changes, the elimination of processed food. And you know, young people love fast food, easy things to put in their mouth. They need to see a therapist, you know, depending on their emotional and mental wellness. Mind-body techniques, the need for exercise, the use of music, calming music, and so on. And the need not to self-blame because PCOS is a genetic disorder. Okay, how important it is for the young people to advocate for themselves, you know, to avoid negative self-talk, bullying, body shaming, unnecessary comments. You know, it's so important for them to know these things. So thank you so much, Ms. Otti, for your part this evening. To Dr. Venkat, thank you so much for, stimulating the audience. I'm sure there are going to be some people in this audience who's going to end up doing research in this area. So the importance of PCOS research and understanding PCOS through your research in both animals and humans, and how important that is for finding a cure, or for finding not a cure, but finding treatment for PCOS. Your research at UV, you shared with us the animal model, the community study perspective research, the awareness seminars, and all of this involves collaboration across diverse disciplines. I'm heartened to know that the research is going on, and for a non-invasive method, which is the use of the electromagnetic radiation to reduce PCOS. So also the importance of your research outlining future direction in the PCOS research. So I hope I summarized everything for this evening. I can't tell you how very grateful I am to the four of you. So on behalf of the Rotary Club of San Fernando and our sponsored Interact Clubs, thank you so very much for taking the time to share what you have with our young adults. I'm seeing a lot of questions coming up. I'm not sure. Are there any special, well, we talked about that. Just give me a few minutes. Let me see. It's just a thank you. I'd also like to add that the conversation of PCOS is avoided or not brought up among the younger men in our country, schools and media enough. So thank you for this opportunity. Thank you so much. Okay, so that brings us to the end of the session this afternoon. I also would like to thank Maria Mohammed Miraj of the Rotary Club of St. Augustine for facilitating this. So putting me on to Stephanie, if you don't mind me calling you Stephanie, Dr. Mohammed, Ms. Sasha Otti, Dr. Venkat, and Dr. Corbin. Thank you so much. And thank you, Maria. So good night and have a pleasant evening.
Good night.
Thank you so much.
And
Good
thank
night.
Good night.
Good night, everyone. Good night.
Good night.